Okay, next is axillary lymph node. Same like axillary vein, it has superficial and deep drainage. Okay, for superficial, it drains lymph from the skin of the hand. For deep lymph node, it drains lymph from capsule, periosteum, tendon, muscle. Okay, superficial skin, deep joint, tendon, muscle. Okay, for lymph vessel, they don't have specific name for them, unlike artery and vein. So we just name for superficial. Okay, superficial lymph vessel, they don't have specific name. It's just that the vessel, superficial lymph vessel, that following the basilic, okay, badan, dekat dengan badan, okay, following basilic will terminate at the cubital fossa and then drain to lateral axillary lymph node, while the cephalic, the lymph vessel following the cephalic vein, will go directly towards axillary lymph node. Okay, apical lymph node. Okay, for deep drainage pula, okay, it will directly terminate in the lateral axillary lymph node. Okay, as you can see from the picture here, okay, the lymph that is drained to the lateral nodes, and it will go to the central node and then go to apical node and collected together in supraclavicular node. So this is how the route, okay, from humeral lateral nodes, pectoral anterior nodes, and it goes straight to central and go upward to apical and supraclavicular nodes. That's how the lymph is being drained. Okay, and this topic also will cover breast and axillary tail. Okay, breast is present both in male and female. The difference is female got mammary glands, okay, and it's become more obvious especially during pregnancy. It extends, okay, you can see from the picture here, it extends horizontally from lateral border of sternum to mid-axillary line. Okay, I'll show you here. Okay, this is the landmark that you should know. This anterior axillary line, mid-axillary line, okay, and mid-clavicular line. Okay, I will explain to you about mid-clavicular line and mid-axillary line. Okay, so for breast extend horizontally from sternum to mid-axillary line, as I've shown you before, just now. It lies on 2/3 on pectoralis major and 1/3 on serratus anterior muscle. Okay. Okay, from the picture here you can see it covers from 2nd to 6th rib, okay, intercostal cartilage, and it has a retromammary space which provides some mobility to the structure, and the 4th intercostal space. Okay, this 4th intercostal space is where nipple located. Okay, as I mentioned before, the mid-clavicular line here, mid-clavicular line, the grandpa picture tadi kan, and 4th intercostal space, this is where you can locate nipple in nulliparous women and men. Okay, so this is important in your clinical examination later. What else? Okay, lobus of mammary gland. Lobus of mammary gland is actually a modified apocrine sweat gland where it produces milk in a lactating mother. And this mammary gland, okay, this one lah, okay, lactating mother kan, mammary gland, the milk produced in mammary gland will go through lactiferous duct and sinus. This is lactiferous duct and this is sinus. Sinus is where the reservoir acts as reservoir for the milk Okay. Okay, lah. What else? Okay, suspensory ligament. Suspensory ligament is here. It separates the lobule of the mammary gland and also act as a support structure for the breast. And Montgomery gland usually in pregnancy, in pregnant lady, is around the areola. It produces oil fluid that lubricates the area, and also produce antibacterial oil, especially in breastfeeding, okay, lactating mother who breastfed her child. This is where the protection comes in. Yeah. Okay, so for the axillary tail is here. It curls around lower border of pectoralis major, so it ends here. Yeah, it's innervated by 4th to 6th intercostal rib. Okay, it's easy to remember. You know your nipple located at 4th intercostal rib, so the nerve that supply breast also from 4th intercostal nerve. Okay, 4th to 6th intercostal nerve. And this nerve does not control milk secretion. Bear in mind, okay, milk secretion controlled by I think prolactin hormone. You will learn this later. And for blood supply is from axillary artery. We have learned about this tadi kan, axillary artery, from thoracoacromial artery, superior and lateral thoracic artery, and also internal thoracic artery from here, internal thoracic artery. Yes. And for venous supply, it drains into axillary and internal thoracic vein. It's easy to remember. The one that artery that supply you also the same name as a venous vein. Yeah? And for lymph drainage, 75% drainage mostly from lateral quadrant of the breast. Lateral quadrant means here, okay, lateral side of the breast. We divide the breast into 4 regions. This is the lateral part. Okay, 75% mostly from lateral quadrant of the breast to pectoral nerve. To pectoral lymph node. Pectoral lymph node here, yeah. And the remainder drains into parasternal lymph node to bronchomediastinal trunk in the thoracic region. Okay. Okay, as I've mentioned before this, we divide the breast into 4 quadrants. The superior lateral quadrant, inferior lateral, inferior medial, and superior medial quadrant. So the occurrence of breast cancer is mostly at the superior lateral quadrant. Okay, as mentioned in the picture, you can see from the percentage there. And this is especially in breast cancer cases, okay, whereby you need to examine the lymph node as well. So, whether the involvement of lymph node at level 1, level 2 or level 3, okay. If there is no involvement or evidence of metastasized to lymph node at the level 1 and 2, so most likely level 3 also safe lah, okay. So you don't have to remove everything up to level 3 during mastectomy. This is more of clinical significance, yeah. And this is how it looks like. Orange. I don't know how to spell it, how to pronounce it, but this is the appearance, how it appears, okay, for cancer patient. And you know why it becomes like that. Pure orange is the appearance of skin, orange skin, kan? So why this happen, you can find it by yourself, I guess. Okay, we will discuss this if you want to know in the synchronous session later. So now for section 3, superficial back muscle. Okay, this is a long lecture, I'm sorry about that. Okay, superficial back muscle, we have this 1, 2, 3, 4, 5, 6, 8, actually 5 muscle. Delta is not the back muscle, but I include it here because I don't know what to include it. So, but I need to teach you deltoid muscle because it is very important muscle for upper limb, yeah. Okay, trapezius. Okay. Okay. It attached. Basically, you can learn from the picture. Okay, attached to shoulder girdle of the attachment of shoulder girdle to the trunk. Okay, the upper segment. Okay, you see here the picture. The trapezius muscle we can divide into the one that ascending. This one is horizontal, and this one is descending. Yeah. Okay. Okay. Sorry. This is upper segment. Okay. Middle segment and lower segment. Okay. So the upper segment is basically originate from the upper segment medial third superior knuckle line. This is superior knuckle line. Okay. You can see at the behind of the skull. This is superior knuckle line, and this is external occipital protuberance. And this is a knuckle ligament. So this is where the origin of the upper segment. For the middle segment and lower segment is from spinous process of C7 to T12. Yeah, sinilah. Okay, and all inserted to lateral 1/3 of clavicle, acromion, and spine of scapula. Okay. This is when I mentioned before this, it helps in elevation of arm together with apa tadi? Supraspinatus up to 15, abduction of the upper limb up to 15 degree, deltoid up to 90 degree, and serratus anterior, serratus anterior and trapezius help in elevation. Okay, all the way. And then the innervation is from accessory nerve. You can imagine how you can try to imagine again how it helps in elevation of the arm, because when the upper and lower segment, okay, upper segment, if this contract, this muscle contract, what do you think happen? Okay, bila ni contract, the scapula will rotate, kan? Glenoid will facing upward. This contract, glenoid face upward. Betul tak? Okay, bila the middle segment contract, the scapula, okay, middle segment contract, scapula retracted ke belakang. Okay, the lower segment, when it contract, bone, it will rotate the scapula. Okay, so the glenoid will facing upward. So it helps in elevation of the arm. Okay, for latissimus dorsi. Latissimus dorsi is the widest muscle. Okay, okay, widest muscle in the body. It's tengok dia punya origin dia. Costal part ada, scapular part pun ada here, and vertebral part pun ada, iliac part pun ada. This is the largest muscle lah kan. And actually this muscle banyak digunakan by athlete. Okay, like macam you pull yourself kan, macam pertama tu yang gimnastik yang guna bar palang tu kan, you to pull yourself, you need latissimus dorsi. Okay, sebab tengok ni dia punya insertion dia dekat bicipital groove of humerus. Okay, meaning that it's a powerful muscle to pull up your body, macam in climbing, in itulah gymnastic. Okay, it also function in arm internal rotation, arm adduction, extension, and elevate body tools. Okay, so it's arm during climbing. Okay, and the muscle that innervate this nerve that innervate this muscle is thoracodorsal nerve.